So this is the public health burden and epidemiology of atopic dermatitis. So AD, atopic dermatitis, is a skin disease affecting both children and adults, and it's mainly associated with its public health burden, which is usually caused by its high prevalence, prevalence and increased healthcare costs. So studying how to control the disease is very complex because of many factors. And this review addresses the complexity and the burden. So the challenges to the epidemiology are that there really is no widely accepted diagnostic tests for AD, and then there also really is no standard name for the disease, and this makes it hard to make consistent questionnaires about it. So they first look into the epidemiology of childhood AD. They state the prevalence to be 6 to 12%, and look at two household surveys from 2003 to 2004 and 2007 to 2008, and they both state no. So the one from 2003 to 2004 was 6 to 12%, and the one from 2007 to 2008 stated the prevalence to be 10 to 12%, which means that the prevalence in childhood eczema is increasing over time, basically. Also, socio-demographic factors were looked at, and it was shown that people, like, there were different groups that were higher at risk in the U.S. Some studies found that there was a high prevalence in African Americans or blacks with AD. So they also looked at the international study. So basically, the international study of asthma and allergies, like the organization, had the best estimate of AD prevalence, and they around the world, and they found that wealthier places had a higher prevalence compared to countries still in development and more poor. And then next, they looked into the epidemiology of adult AD. Two studies from before 2000 showed the prevalence to be 2 to 6%, but now it is at 7 to 10% in adults, and both were randomly sampled adults. And this could be for a few reasons. This could be because people now realize that AD doesn't burn out as much as they used to think, and also that adult onset of the disease is more common than they previously thought. But this is controversial because some people think that the people that think that they have adult onset are just people that didn't know they had it in their childhood. So yeah. But this may be just because the prevalence has increased over the years. So then they looked at the severity to view the burden of the disease. So severity assessments reflect lesional severity, so basically itching and sleep disturbance and things to do with the scratching, and the extent of the disease too. So although prevalence decreased with age, the relative severity proportions increased. So also, then there is the cost of AD. So although it's not a fatal disease, it is something that there's no cure for at all. So people have to learn to cope and manage with it with medicine over long periods of time. So two older studies of 1993 and 2002 estimated the direct payer costs of AD to be 364 million and 3.8 billion per year. But this, however, underestimates the population boom in the years now, and the increasing prevalence. And they also do not include the costs associated with the comorbidity of the diseases. So basically, people with eczema can also get asthma and more allergy-related diseases along with the eczema. So, but however, the burden also extends to the fact that these patients are limited to many physical activities. So they really don't want to go outside as much or participate in social interactions because they feel bad about their disease. And then they're put in situations they are their employment, their performance is more impaired at school or work, and they have higher rates of anxiety and depression.